Hey buddies, welcome to Analytic Tutor. This is Jatin. So today we are going to discuss the topic crystalloids and colloids. So in this video we are going to discuss about what is crystalloids and what is colloids and the composition of these crystalloids and colloids and key differences and composition and expansions of these crystalloids and colloids and the clinical features and clinical preferences among these crystalloids and colloids. So without any late, we are going to start our session. Crystalloids and colloids. We have different types of IV fluids which are divided into crystalloids and colloids. So in this video, we are getting some clarity about what is crystalloids and what is colloids and why these IV fluids are classified into crystalloids and colloids. So without any late, let's start crystalloids versus colloids. So crystalloids are the solutions. So crystalloids are the solutions which contain small molecules. Crystalloids are the solution which contain small molecules, and when it comes to colloids which contain large molecules. So crystalloids can easily pass through blood vessels, but when it comes to colloids are it is impossible to pass through blood walls. So crystalloid consists of water and electrolytes, and when it comes to colloids consist of protein or starches. Examples of the crystalloids are normal saline, ringer lactate solution, and 5% dextrose in water. So when it comes to colloids, so albumin, hexastarch, pentastarch, and gelatins. So these are belongings to colloids. So uses of crystalloids. So when it comes to uses, we mainly use crystalloids to treat dehydration and maintain fluid balances, and also used for dilution of drugs during IV procedures. These crystalloids are the first line treatment for fluid resuscitation. So when it comes to colloids are used to increase the blood volume. So this is mainly used during blood loss, and it is more quickly and effectively works during blood loss. These are also used during shock or during surgery. So this is about the uses of colloids. So when it comes to distribution, crystalloids quickly distribute into the interstitial and intercellular spaces, not staying in the blood vessels. So these also can diffuse throughout the body tissues. So when it comes to colloid distribution, so colloids only stay in the blood vascular compartment. So this helps to increase the volume of blood. So this helps in expansion. When we infuse these colloids into the bloodstream, so it stays within the vascular compartment. That's the reason uh, we prefer colloids over crystalloids. So volume expansion. So when it comes to volume expansion, so crystalloids require large volume to achieve same effect as colloids in increasing blood volume. So when we infuse colloids, this helps in volume expansion, and these colloids stay in blood vessels. So that's the reason we prefer colloids. That's the reason we prefer colloids over crystalloids. So these are more effective in increasing the blood volume, which is mainly used who require rapid replacement and who require rapid blood volume. So this is about crystalloids and colloids. And when we go to the key differences, so when we go to key differences, molecular size. So crystalloids have small molecules while compared to colloids which have larger molecules. And volume distribution, so crystalloids distribute more evenly between intravascular and extravascular spaces, but when it comes to colloids stay in the intravascular space. So that's the reason which increase blood volume. So and effectiveness in the expansion. So when it comes to colloids are generally more effective in blood expansion of blood volume while compared to crystalloids. And a clinical consideration. So clinical consideration, we mainly prefer crystalloids over colloids because crystalloids are the cheaper in price and side effects. So when it comes to side effects, colloids cause allergic reactions and affect the blood clotting as compared to crystalloids, but crystalloids usage may cause edema in excessive amounts. So this is about crystalloids versus colloids. So follow for more such content. So thank you so much. Signing off.